I rise for a point of personal privilege.
Gentleman may proceed.
Thank you, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, I rise today in support of what I hope will become a successful bipartisan effort to assist some 400,000 Virginians who do not presently have health insurance and a number of hospitals who face some very serious economic peril. In the governor's recent address to this joint assembly, he made a strong and compelling business case for why it is in our economic interest to find a way to insure more Virginians. He stressed the importance of reform while complimenting the efforts of Merck, Governor McDonnell, and Secretary Hazel for all their efforts to bend the cost curve on Medicaid and to provide services that work better and cost less. Sometimes in this chamber, we can be so focused on political differences that we lose track of some of the things we can do together. We know that many of our citizens have great need. Over 1 million Virginians remain uninsured. Of those who receive some kind of Medicaid benefit, 1/2 of those are children, and another 260,000 are either blind, elderly, or disabled. Medicaid is hardly a treasure trove of riches for those who receive its benefits. We rank 48th among the states in spending per capita, and our reimbursement rates to providers and hospitals are low. Nonetheless, it does provide some level of service, some level of assistance for those who are in need. And as you know, the state presently pays 1/2 of the cost, and the federal government pays the other half. Most of us agree that reforms in Medicaid are necessary. And if you go to the Merck website, and I commend you to do so, you will be impressed by what has already occurred in Virginia. And we will need to do more, because true reform is a continuous process. If we want an efficient government that works better and costs less, we need to continually push for reform. We will talk about that reform in future days, but for today, let's focus on what's before us. As we discuss our options for this session, perhaps we can ask ourselves some critical questions. Why wouldn't we, for example, want to insure 400,000 Virginians, many of whom work, and all of whom are our friends and neighbors? Why wouldn't we want to lessen the financial impacts on our hospitals and our ERs so that they may retain their viability, both as economic engines in their communities and as job providers for our citizens? Why wouldn't we want to create as many jobs as possible by investments in health care that serve our citizens? And why wouldn't we want to keep Virginia taxpayer dollars working for us in our state rather than sending them to other parts of the country? Most of us want to find a way, a Virginia way, to make these things happen. And I would submit that this Virginia way will involve building on the reforms of Merck in order that we can bend that cost curve and not subject Medicaid to an unsustainable future. I want to draw your attention to an illustration to point out at least one of the key issues that we face. Few of us will dispute the fact that Virginia taxpayer dollars are being sent to Washington and reprogrammed into some 25 states who have decided to expand insurance coverages to those citizens in need. This map shows where the money is going: to New York, to California, Arizona, Iowa, Connecticut, red states, blue states, big states, little states. These are our taxpayer dollars, our money. Why wouldn't we want to bring that money back so it can work for us in our communities? As you well know, the Hospital Association has talked about what we are losing each day. That is $5 million. Between January 1st and today's date, it is $75 million. That graph continues to rise. It will increase every day. We are essentially creating a sea of red ink of our own device. There is much to be said about this issue, and it will be said in the days and the weeks ahead. There are reforms to discuss, implications to be considered, and common ground to plow. If we remain open to all options, we will find a way, a special Virginia way, to help our citizens and our communities address these needs, to stimulate our economies, and to protect our citizens. Thank you, Mr. Speaker.